We've been saying quite a bit about wearing PPE and the utility gloves, but what does OSHA actually say about PPE? I'm going to share with you a very formal definition, so bear with me while we read through this, and then we'll talk about what it actually means, because we've all learned to use PPE in our office. But you know, when the peak of the pandemic, we wore more PPE, didn't we? We did systems that were entirely different that we'd never thought of before. And now that the pandemic has waned, we're wondering, what do we do? What should the PPE be? Should we go back to what I call BC, before COVID? Or do we stick with our COVID protocols? Well, the answer was more of the latter, sticking with the COVID protocols, because COVID has not gone away. It's going to be endemic in our society forever, and it will peak and wane just like the flu season does. So OSHA's definition of PPE is specialized clothing or equipment. It does not permit blood or other potentially infectious material to reach through or pass your work clothes. That would be your uniform. Your street clothes. That could be the long sleeve t-shirt that you wear under your scrub top. Your undergarments, skin, eyes, mouth, or mucous membranes. And this PPE has to last under the normal conditions of use, meaning we're in aerosol generating procedures, right? And the duration of time. How long is that procedure appointment? So this is how long the equipment has to last, the normal conditions of use and the normal time that we're using it for the equipment to be effective. So what does that translate into? I'd like to share with you this pictogram from the CDC. We started using this pictogram with the pandemic, and I think it's still applicable today. This is the preferred PPE to use. And let's start at the top and kind of work our way down, if you will. During the peak of the pandemic, we saw many dental teams adapt using hair bonnets or hair caps, if you will. That's not a particular requirement written into the law, but it is a good idea to protect our hair and our head. We know that we're going home with spray and splatter in our hair, and hygienists, let's face it, I bet we've all gone home with calculus in our hair as well. So protecting your head is important. Then moving on to our face. OSHA states that you have to have a face shield or goggles. It's one or the other. You don't have to have both. But how does that work if you have glasses and loupes? Let's talk about that in just a moment. A face shield comes down at its chin length, so it covers your full face. If we were to look at if saliva were red and look at our face after we've been in an aerosol generating procedure and we're not wearing a face shield, any place that's not covered by your glasses or your mask is going to be covered with aerosols. So we're taking home contamination on us personally for not wearing a face shield. Previously, OSHA said we could wear safety glasses and that we could also have side shields on our prescription glasses, and that would be OSHA compliant. But that is no longer the case, because last year, ANSI, the American National Standards Institute, updated the eyewear requirements, and OSHA looks to ANSI to set those requirements. So in the past, we could wear goggles, and they might be some of those cool glasses that look like aviator safety glasses, right? But no longer is that appropriate. You see, ANSI did some updated research and determined that under our eyes is a very vulnerable place for injury, and that safety glasses do not adequately protect under our eye as well as other areas of our eyes as well. Think about this fact. From the research, they determined that anything coming at your face from a high-speed handpiece is coming at you at 50 miles an hour. You don't even have a chance to blink. So having goggles that has that extra protection under the eye and all around the eye is imperative. Now you may say to me, hey, that's great, but I wear loupes and I can't find any face shields that work with my loupe. And I can empathize with you. Please look at some of the other brands on the market that maybe just clip onto your loupes, and that way you'll have the one that fits. And there are several brands that just clip onto the loupes and they don't go entirely around the head. But you do want to find a face shield that is lightweight, easy to use, and is cleanable. Follow the manufacturer's instructions for use, because you may have to clean it with soap and water versus our disinfectants, because sometimes those chemicals will scratch the surface of your face shield or damage it. So again, it's face shield or goggles, but not safety glasses and definitely not prescription glasses unless you have a face shield or goggles over them. Next, we move down to our nose and our mouth. Historically, we've always worn a level 3 surgical mask during any aerosol generating procedures, haven't we? Because that mask has the fluid resistant capability, and that mask is the one that lasted longer than a simple level 1. Then during the pandemic, we learned that it was the surgical N95 mask that was required, because this mask had an entirely different filtration system and it better protected us against transmission of SARS-CoV-2. Let's draw a distinction between those two masks real quick. A surgical level 3 mask filters out a particle size of 0.6 microns, 0.3 microns. Okay, that's pretty small. And we think of measuring things in millimeters in a dental practice. These are microns, much smaller. However, a surgical N95 respirator mask filters out a particle size that's 0.3. 0.3. That is the size of the SARS-CoV-2 coronavirus. So yes, if you wear a surgical mask only, you are not filtering out any aerosol-generating procedures that may have SARS-CoV-2 if the patient doesn't know they're contagious. So please keep that tip in mind with the mask, because wearing 2 level 3 masks does not compensate. Taping a level 3 mask to your face doesn't compensate. And wearing 2 masks together over an N95 mask can dislodge the seal of a properly fitted N95 mask. And I've been stressing the point that this is a surgical N95 mask. And the reason that I'm using that phrase is because a surgical N95 mask is one that is fluid resistant. An N95 mask that you can buy from the hardware store is fine if you're a construction worker or you're doing some home remodeling and you're sanding sheetrock or wood or whatnot, but it's not surgical. Surgical has that fluid resistant capability that we need so much in a dental setting. Next on the list is our isolation gown. We probably have gone back to using our regular scrub jackets at this point, and that's fine. That's fine. OSHA says that as your scrub jackets, your PPE can be worn for the entire day unless it becomes visibly soiled. More times than not, during all of our surgical procedures, more likely you're wearing a disposable gown and changing that out after each surgical case because there is more blood involved in those cases. But what I'd like to share with you is how to think about protecting yourself more with your scrub jackets. You see those traditional scrub jackets that we all love and they're all monogrammed? They're great because they have a ribbed cuff and they come up and they snap around your neck so they're flat. They cover your neck, which we know a lab coat doesn't. But guess what? That scrub jacket has never covered our lap when we're sitting there during the dental procedures and our scrub pants are going home soiled all day long. So I'd like you to think about this year in your office or organization is how can you improve your PPE protection? One way is to look at new types of scrub jackets as it's time to refresh your uniforms in your office or organization. There are different brands on the market that come longer length and that are fluid resistant. So looking at other options is important because now we begin to really fine-tune how we're protecting ourselves. And I share this tip with you because I have not mentioned yet the fact that OSHA is in the middle of promulgating another standard that will apply to dentistry that will be related to airborne transmissible diseases and other infectious diseases. You know, at this time, we're talking about the bloodborne pathogen diseases. We're talking about the bloodborne pathogen standard, but this would be an airborne transmitted disease and would cover different types of PPE perhaps. So we start thinking about those terms and what may be coming in the future and prepare by having good PPE and maintaining the standards that we implemented during the coronavirus crisis. Exam gloves, we're all familiar with our exam gloves. We're wearing them, we're taking them off. We're not touching anything in an operatory without an exam glove. However, I'd like you to draw the distinction between when to use those utility gloves and when to use the exam gloves. Once you dismiss that patient and you come back to break down the room and start your cleaning process and disinfecting and then move into sterilization, that's when your PPE changes entirely. When we work with patients, yes, we use exam gloves and not utility gloves. But once that patient has left the room, now we're moving into a different process and we're cleaning and disinfecting the operatory and we're working with our instruments in a different fashion. That's when the utility gloves and that special transport container come in handy. So when you walk back into your operatory after dismissing the patient, that's when you don your utility gloves as well as your other PPE and you gather up your special container from under the sink in your operatory. And now you're set and ready to go, and it's an easy workflow process.